Approximately 24,000 people in the U.S. are diagnosed with primary malignant brain tumors each year. About 60% of these people die each year as a result of these malignant tumors. A glioma is a type of primary central nervous system tumor that typically starts in cells called astrocytes. The most common site for a glioma is the brain. Astrocytes, named for their star-like shape, form part of the supportive tissue in the brain called glial cells. Glial cells provide insulation for neurons and help form the blood-brain barrier. Gliomas are graded in terms of how abnormal they look under a microscope and how quickly they are likely to grow and spread. A high-grade glioma is malignant, life-threatening, invasive, and usually fast-growing. Whenever possible, surgery to remove the tumor is considered part of the standard of care treatment for high-grade malignant gliomas. The intent of the surgery is to remove as much of the tumor as possible while avoiding unnecessary neurological damage. However, surgery alone may not be enough. Because of the invasive nature of high-grade tumors, malignant cells may still remain. Carmustine, also known as BCNU, is a form of chemotherapy that can be useful in treating brain tumors like glioblastoma multiforme, otherwise known as GBM. GLIADEL Wafer prolifersan 20 with carmustine implant is indicated in patients with newly diagnosed high-grade malignant glioma as an adjunct to surgery and radiation. GLIADEL Wafer is also indicated in patients with recurrent glioblastoma multiforme as an adjunct to surgery. GLIADEL wafers are small, dime-sized, biodegradable copolymer wafers. GLIADEL Wafer is designed to deliver carmustine directly into the surgical cavity created when a brain tumor is resected. After a neurosurgeon operates to remove the high-grade malignant glioma, he or she implants up to 8 GLIADEL wafers along the walls and floor of the cavity the tumor once occupied. Each wafer contains a precise amount of carmustine. Patients undergoing craniotomy for malignant glioma and implantation of GLIADEL Wafer should be monitored closely for known complications of craniotomy, including seizures, intracranial infections, abnormal wound healing, and brain edema. Cases of intracerebral mass effect unresponsive to corticosteroids have been described in patients treated with GLIADEL Wafer, including one case leading to brain herniation. Carmustine, the active component of GLIADEL Wafer, can cause fetal harm when administered to a pregnant woman. Additional important safety information will be presented later in this video. GLIADEL Wafer is designed to deliver carmustine directly into the surgical cavity created when a brain tumor is resected. What follows is a graphic depiction of potential activity of GLIADEL Wafer within the resection cavity following implantation. Please note that the absorption, distribution, metabolism, and excretion of the copolymer is unknown. Carmustine concentrations delivered by GLIADEL Wafer in human brain tissue have not been determined. Plasma levels of carmustine after GLIADEL Wafer implant were not determined. Carmustine is a member of a group of chemical compounds known as alkylating agents. It produces its anti-neoplastic effect by disrupting the function of DNA and RNA. At the molecular level, the moisture between the cell membrane and GLIADEL Wafer breaks down the copolymer, triggering the release of carmustine. The rate of biodegradation varies from patient to patient. More than 70% of the copolymer degrades by 3 weeks. The absorption, distribution, metabolism, and excretion of the copolymer in humans is unknown. Carmustine concentrations delivered by GLIADEL Wafer in human brain tissue have not been determined. Plasma levels of carmustine after GLIADEL Wafer implant were not determined. GLIADEL Wafer is designed to deliver carmustine directly into the surgical cavity created when a brain tumor is resected. The carmustine released from the GLIADEL Wafer diffuses into the surrounding brain tissue and produces an anti-neoplastic effect. GLIADEL Wafer is the only FDA-approved chemotherapeutic implant for use during neurosurgical resection. GLIADEL Wafer prolifersan 20 with carmustine implant is indicated in patients with newly diagnosed high-grade malignant glioma as an adjunct to surgery and radiation. GLIADEL Wafer is also indicated in patients with recurrent glioblastoma multiforme as an adjunct to surgery. GLIADEL Wafer prolifersan 20 with carmustine implant should not be given to patients who have demonstrated a previous hypersensitivity to carmustine or any of the components of GLIADEL Wafer. Patients undergoing craniotomy for malignant glioma and implantation of GLIADEL Wafer should be monitored closely for known complications of craniotomy, including seizures, intracranial infections, abnormal wound healing, and brain edema. Cases of intracerebral mass effect unresponsive to corticosteroids have been described in patients treated with GLIADEL Wafer, including one case leading to brain herniation. Carmustine, the active component of GLIADEL Wafer, can cause fetal harm when administered to a pregnant woman. It is recommended that patients receiving GLIADEL Wafer discontinue nursing. Communication between the surgical resection cavity and the ventricular system should be avoided to prevent the wafers from migrating into the ventricular system and causing obstructive hydrocephalus. If a communication larger than the diameter of a wafer exists, it should be closed prior to wafer implantation. CT and MRI of the head may demonstrate enhancement in the brain tissue surrounding the resection cavity after the implantation of GLIADEL Wafer. This enhancement may represent edema and inflammation caused by GLIADEL Wafer or tumor progression. The short-term and long-term toxicity profiles of GLIADEL Wafer when given in conjunction with chemotherapy have not been fully explored. The following 4 categories of adverse events are possibly related to treatment with GLIADEL Wafer. Seizures. In the initial surgery trial, the incidence of seizures was 33.3% in patients receiving GLIADEL Wafer and 37.5% in patients receiving placebo. Grand mal seizures occurred in 5% of GLIADEL Wafer-treated patients and 4.2% of placebo-treated patients. The incidence of seizures within the first 5 days after wafer implantation was 2.5% in the GLIADEL Wafer group and 4.2% in the placebo group. In the surgery for recurrent disease trial, the incidence of post-operative seizures was 19% in both patients receiving GLIADEL Wafer and placebo. In this study, 12 out of 22, or 54% of patients treated with GLIADEL Wafer, and 2 out of 22, or 9% of placebo patients, experienced the first new or worsened seizure within the first 5 postoperative days. The median time to onset of the first new or worsened postoperative seizure was 3.5 days in patients treated with GLIADEL Wafer and 61 days in placebo patients. Brain edema. In the initial surgery trial, brain edema was noted in 22.5% of patients treated with GLIADEL Wafer and in 19.2% of patients treated with placebo. Development of brain edema with mass effect due to tumor recurrences, intracranial infection, or necrosis may necessitate reoperation and in some cases removal of GLIADEL Wafer or its remnants. Healing abnormalities. The following healing abnormalities have been reported in GLIADEL Wafer clinical trials: wound dehiscence, delayed wound healing, subdural, subgaleal, or wound effusions, and cerebrospinal fluid leak. In the initial surgery trial, healing abnormalities occurred in 15.8% of GLIADEL Wafer-treated patients and 11.7% of placebo recipients. Cerebrospinal fluid leaks occurred in 5% of GLIADEL Wafer recipients and 0.8% of those given placebo. During surgery, a watertight dural closure should be obtained to minimize the risk of a cerebrospinal fluid leak. In the surgery for recurrent disease trial, the incidence of healing abnormalities was 14% in GLIADEL Wafer-treated patients and 5% in patients receiving placebo wafers. Intracranial infection. In the initial surgery trial, the incidence of brain abscess or meningitis was 5% in patients treated with GLIADEL Wafer and 6% in patients receiving placebo. In the recurrent setting, the incidence of brain abscess or meningitis was 4% in GLIADEL Wafer patients and 1% in patients receiving placebo.